Welcome to Bonita's Maternity Program webinar. Today we're speaking with Sister Ingrid Groenewald, who will be chatting to us about the importance of microbes in pregnancy and in birth. So welcome, Sister Ingrid.
Thank you very much. I am very happy to be here with you today, and today is a very exciting topic. So I hope you all have clean ears today. So this is really such an important event, even being pregnant, in pregnancy, and by thinking about your birth and the things coming up. So I think in most cases it's often pregnancies, pregnant ladies that are listening. So welcome for all of you, and then also if there are some new moms already, so also welcome to you as well. So with microbes, it's actually like a new kind of term. It's a new thing where people start to realize the importance of it. And perhaps I should actually start by saying, it's quite interesting to think that we as humans are starting to be so, we're evolving, we're changing. I'm just going to change, I say. We are starting to become so clever in the sense that, if you think about technology, people go to space, technology is just developing at such a rapid speed. Yet at the same time, it seems like as we become more clever, it's almost like disease is taking over and more people struggle with all sorts of illnesses and diseases. And this is really the question where people started to. So just for interest sake, did you know that you have more than 100 trillion microbes on and in your body? That is way more compared to what is actually how many skin cells and body cells we have. It is actually outnumbering the human cells with 10-1. So it shows you really how many things we are actually not even aware of. It's just on our bodies and in our bodies. So this is really very interesting, and it's really important to understand exactly why this is so important. So perhaps just to start off with, what exactly is a human microbe? So the human microbe is a collective term actually for all the microbes that we actually host on our bodies. And this is from bacteria to viruses, to all sorts of things like fungi, protozoa, and all those kind of things. So we are really the host, and all of this is living in and on our bodies. And usually microbes are found everywhere. If we think, it's in our mouths, it's on our skin, it's eyes, ears, it's everywhere. And the place that is really very important, and the most of the microbes are actually sitting in our guts. And this is where the important thing is, and the importance of to understand also how this actually then, what does it mean for pregnancy and what does it mean for birth? But before we get to that, perhaps just to look at the connection between the human microbiome and disease. And this is what I started off with. Why is it that people are getting more and more sick, or that disease is actually taking over? So if we think about microorganisms, most of the microorganisms that we actually have on our bodies and in our bodies are actually harmful. They're there, they're not going to make you sick. They basically just living on our bodies, and it's to the benefit of your body, so that is something that you actually have on you. When in balance, these microorganisms help to keep your body healthy. So it actually fights disease. So it's almost like your little soldiers, that is working for you and with you to keep your body healthy. The problem comes in if there's a slight imbalance. And this is where, if some of the harmful bacteria take over, that is then in the case where there's an imbalance, and there are some diseases linked to this imbalance. And some of them are even like asthma that's taking over. The person is more likely to develop asthma. Allergies is more likely, IBS is more likely, autoimmune disorders, obesity, and even it's linked to certain cancers. So it's more and more a situation of trying to think, we never thought that these microbes are actually so important, but it's really like your little soldiers, and you want to equip your soldiers with really by having good, strong soldiers. So it is important as to what we do in our lives, what happens in pregnancy, what happens at birth, and all of that. So in pregnancy, if we think being pregnant, you've got your baby in the uterus, the baby's in the amniotic fluid. In the past, we used to think that everything is very sterile, and it is. It is the perfect place for your baby to be and to grow and to develop. But now it seems that the baby is in actual fact also starting to get in contact with the mother's microbes, and that is through the placenta, that is through the amniotic fluid, and also the uterus. So there's some sort of contact that is starting to take place even before birth, which is really important. And also in your body, if you think your body has all these bacteria in your body, the lactobacilli bacteria, that is a really good bacteria to have. That is one of the best ones. It's a good one for you. It fights for you. It keeps you healthy. And that is the bacteria that actually takes over your body, and it's all basically in the vagina. You start to have more of that in pregnancy. So it's really starting to take over, you know, in the gut and then also in the vagina. And one of the reasons there, it is starting to prepare for the birth of the baby and for breastfeeding your baby. So this is why your body is starting to change for the health actually of this newborn, you know, this or this unborn baby that you basically have. So if you think also that your body, the mother's body, is like a reservoir of bacteria, of these microbiomes, and that is why it is so important to take care of your body, because, and I will get to that, with the birth, this baby gets in contact, it's seeding with the mother's good bacteria. So you are the reservoir of these bacteria that you are starting, that you have, and the lactobacilli that is starting to take over, so that at birth, the good bacteria are given to the baby so that the baby gets in contact with that. And that is why it's so crucial in pregnancy even to think, you know, what are you doing? What are you eating? How affecting microbes? What medication are you drinking? Antibiotics is a concern. Obviously, if you are sick, if you're already sick and you need it, by all means, that is something that one needs to have. But if there's a debate about should or shouldn't you, antibiotics actually is not always the greatest in the sense for the microbes, because the good bacteria are also affected. These microbes are also affected. And that is something to keep in mind, okay? So in pregnancy, your body is really the host of these good bacteria for your baby, and you want to keep it at a, you know, that it's really working well, you know, specifically for the birth and then also for afterwards when you are breastfeeding your baby. Okay, so what then exactly happens at birth? And this is something that I have now said, said a couple of times, but I actually want to read a quote to you. And this is something that Tony Harmon actually wrote. And I must say, a lot of this information I got from an online course that I also did from Microbirth, which is really interesting to really educate even yourselves as to what happens, you know, with the microbes on our body. So she said, two amazing things or two amazing events happen during childbirth. There's the obvious main event, which is the emergence of a new human into the world. But then there's also the non-human event that is taking place simultaneously, a crucial event that is not visible to the naked eye, an event that could basically determine the lifelong health of the baby. This is the seeding of the baby's microbiome. However, with interventions like the use of synthetic oxytocin, antibiotics, cesarean sections, and formula feeding, this microbial transfer from the mother to the baby is interfered with or is sometimes bypassed completely. And that is something to really think about. You know, we sometimes make decisions and something happens and you don't even aware of it as what the effect is, but there are sometimes long-term effects. So what exactly do I mean with seeding and what happens at birth? So if we think about it, this baby is now in this environment, in the uterus, the amniotic fluid is around the baby. Once you go into labor and your water breaks, that water comes out, and suddenly there's a direct path with the baby that is in the birth canal and the microbes of the guts, and then also of the vagina at that point, so there's lots and lots of microbes that the baby is actually getting flooded in. So the baby is suddenly surrounded by all these trillions and trillions of microbes. It's getting contact with that. It gets in contact with the eyes, with the ears, with the mouth. Sometimes babies even swallow some of it. The skin actually gets it. So the baby's completely coated with these good, mother's vaginal microbes. So what happens is that this first contact with, and even this is even unborn, it's still before the birth even, that contact that takes place, the baby's body is starting to see these bacteria, and it actually starts happening in the baby's body. So that is why it's really good to have the good bacteria that actually, that it actually happens at that time. So it's also not just the vaginal bacteria, but also the fecal bacteria. If you think about the gut, and if you think about natural birth, sometimes even there's some fecal matter that the baby gets in contact with, even if it's to the naked eye that you can't see it, but it's still there. And it actually has some really, really good bacteria there, and it's all really beneficial bacteria. And that contact that the baby is having at that time really helps to promote this good seeding of these good bacteria in the body of the baby. And this really helps for health. This helps for lifelong health. It's basically starting the baby at a better foot, to stand on by being healthier. The good bacteria are taking over, because we know that the bacteria actually has such a big influence on your health. And this is how the baby's life is starting out of the uterus, is with these good bacteria that the baby is getting in contact with. So we know that the first bacteria that the baby gets in contact with, that is the ones that seed in the body of the baby. And that is what actually happens. It's training the immunity or the immune system. So this is really the time when the baby's body is figuring out what is normal, what is not normal, what is good and what is bad, what is friend and what is foe. And you want to encourage that it's the good bacteria that the baby sees as good, and it's the bad bacteria, the bacteria that the baby then sees as bad. So this is the reason, one of the majority or the best reasons or the strongest reasons that goes for natural birth, because with a natural birth you are equipping the baby in, you're giving this baby time to actually be in contact with these good bacteria that actually can take over the body, and that can start this reaction within the baby. Okay, so that is really important. And in the coming weeks, if we think about it, with a newborn baby, they don't do a lot, they feed and they sleep and they poo and all this. But as he's getting older, or she's getting older, later on, she's going to start putting things in the mouth. She's going to start kissing the dogs and the cats and eating the dog food, and chojos on the floor is going to be placed in the mouth. That is all also part of immunity training, so that is getting in contact with it. But that is really good with the background. It's like the materia, and that is why it is so important to think about your birth, to think about how are you going to give birth. Is it going to be a natural birth? And by really trying to push for this, because it does affect the health of the baby. We know it can actually cause all sorts of problems and illnesses potentially if the bad bacteria, if I can say it like that, are actually in the majority of the baby's body. So in reality is that we live in South Africa, and we have a very high cesarean rate, so it definitely is something that happens all the time. So if you're listening here and you think, oh gosh, how are you going to do this? You are actually scheduled for a cesarean, or perhaps you're still on the line, you're not quite sure if you're going to go natural or going to go, have a cesarean. we need to actually also then address the cesarean rates, or the cesarean section, as to, or the cesarean birth, perhaps that's a better term, as to what happens at a birth, and with a cesarean, and also what can you do if you will definitely have a cesarean, okay, because there are some things that you can do to help, okay. So first of all, with a cesarean section, this baby most likely did not have contact with the mother's microbes, not with the gut microbes, definitely no fecal matter that the baby was exposed to, or even the vaginal microbes. So it's likely that this baby did not have that exposure. So it's a different set of microbes that were basically forming, within the body, that is seeding within the body. I have to also just point out that cesarean sections can be life-saving. I'm definitely not telling you to not have a cesarean. In a situation where it's to the benefit of the mother and the child's health, by all means, a cesarean section is the way to go, okay? But if you're still not quite sure, if you worry about this or that, but you could have a natural birth, but perhaps you don't want the contractions and things like that, this is for you to really say, perhaps sit back and really think about this as to what you can do to really try to get your baby at a, even for the health of your unborn baby, okay? But just to get back to cesarean sections, it is likely, because there are different bacteria present it's a very sterile environment at theatre, whatever the baby gets in contact with, those are the bacteria, and it's often hospital bacteria that are there that the baby actually colonizes, okay? So we know now also, if one looks at statistics, if you look at the recent research, that they're linking cesarean sections with the increased risk of developing asthma, type 1 diabetes, obesity, and celiac disease are one of the, a few of the illnesses or diseases that are actually linked to cesarean section. So it's not just an easy way out to say just have a cesarean section. It's really something to think about, to research, do your research as to what do you think is best for you. So if you are sitting here and you think, oh my word, okay, so now I've had it, what can you do? Okay, there are a couple of things. Now, first of all, if you schedule for a cesarean section, I would say wear the blankie, wear the beanie that you're going to put on the baby's head, on the head. So you can take, to theatre, you basically take a blanket, put the blanket on the inside of your clothes, on your chest, wear it for a couple of hours before. Okay, so just have it on your body. That your bacteria is starting to actually also go on. So a little bit of you is coming onto the blanket. Same thing goes with a little beanie that is going to be placed on the baby's head. Wear that, okay, wear that so that a little bit of your bacteria is on it. So that with a cesarean section, this is the blanket that you then give to them in theatre, so that this is the blanket that they can cover the baby with, okay? So to have some sort of contact with the direct, with that. Obviously, skin to skin is really important, okay? So directly after cesarean, the best case scenario would be if a baby is placed on the mother's chest. That is not always possible with a cesarean section, but this is where the little blanket comes in, and then after they've taken baby just next to you, looked at baby, and then has handed baby back to you, but then baby's in the little blanket that you were wearing just before, and also the baby has a little mitten on, or not a mitten, the beanie on, that helps the baby to also have some of your bacteria. Some really interesting research that's currently ongoing is what they call swap seeding, and this is to try to mimic a little bit of a vaginal birth with a cesarean. And this is where they're taking a bit of gauze, and then the gauze is basically inserted about an hour or two before the cesarean. into the vagina. So it's like a tampon. And then what happens is just before you go to theatre, it's been removed from the vagina. It's taken to the theatre. So once the baby's born, directly at birth, you know, they take the spores, and then this baby is completely like wiped all over the body, over the face, the, you know, the body, in the mouth, even the back, the everywhere, the whole body is wiped with this gauze. And the idea is to try to get the mother's vaginal microbes on top of the baby, you know, to really help the baby to seed these microbes. And this is really very interesting research. They're currently ongoing with that, and it really looks really promising. So perhaps in future, it might be something that might be done to all cesareans. It might even be something that you can request your doctor and say, you know, this is something that you heard, and you do your research about it, and this is something that you can do to try to get the baby to seed your good microbes. Okay, so the vaginal microbes that are then in the vagina is then basically given to the baby at birth, at the cesarean. Okay, so directly after the baby's been taken out, then suddenly baby's wiped, you know, with it. And that is really something that is quite interesting, the research currently that is ongoing. But yeah, so there are some things like that, and then obviously lots of skin to skin after that. You know, once you back, you know, back from theatre, mommy and daddy can do it. Obviously, the mother, it is your bacteria that you really want seeded in the baby. So I would definitely recommend mom a lot. Okay, but dad can definitely also help with that. And then obviously we cannot not talk about breastfeeding, because the breast milk that you're giving to your baby is helping with the seeding of these microbes. So again, it's not just a situation of let's just feed the baby something, you know, it is really such an advantage for a baby to get breast milk, not just for nutrition, but also for immunity. And something that is quite interesting, you know, a couple of years ago, it was something that nobody knew as to why there are certain parts in the breast milk, and that is the human milk oligosaccharides. That is a kind of a sugar, but it cannot be used by the baby's body. So the baby's body cannot use it at all. And the big question was always as to why is it there? Why is something in breast milk that's given to the baby, but the baby can't use it? And it's only really recently where it's been found that, you know what, you're not giving it to the baby, you're giving it to the microbes that the baby has, that the baby received from the mother. So these good bacteria that came from the mother to the baby that is now seeded and is taking over in the body, that needs food. Okay, and the best food for that is, you know, these specific parts in the breast milk. And that is really exciting to think that you are actually making something for the microbes of your baby. And that is one of the huge advantages of breastfeeding. You are actually helping your baby and these microbes to become really strong, so to basically help for health of your baby and to try to avoid certain illnesses and things like that. So you're basically enabling the right kind of bacteria, you know, by breastfeeding. You're enabling the right kind of bacteria to take over in the body and to really be there and to really keep the baby healthy. So that is really interesting. The thing is with formula, if you give formula, and even if you do give just a little bit of a top up every now and then, the formula actually changes the pH in the baby. And then also it can cause some irregularities with the microbes. So you're actually causing a bit of an imbalance. And that is what one tries to avoid at this point. So if possible at all, it would be exclusive breastfeeding for a long time. So I would actually say, aim for the middle of the first year. So for 6 months, baby only gets breast milk, nothing else. Okay, because then you are giving your baby, you know, breast milk, which is really good in nutrients, but also at the same time you're giving the kind of the food for the microbes to really be very strong and very active in the baby's body. And that is really what you want. You want this to happen so that you can have a healthy baby, and that the baby has the best chance possible to be as healthy as the baby can be. Okay, so I'm going to just I know this is a whole mouthful of things that I'm talking to you about, but I just want to end off with some suggestions. So some suggestions of how then can you have a healthy pregnancy and a healthy baby in birth? Okay, now first of all, the research. There's not enough of that. You know, do your homework, talk to your care provider, look about the, you know, all the different options, because you've got options. Okay, so by looking at all these things is very important. And then if we think about your own health, even look at what are you putting in your mouth, what are you eating. You know, it is so important. It's now more than important than ever, and we know how important it is to try to keep our microbes as good and strong as possible. Okay, and that is with good raw food. Okay, so not the processed kind, you know, not the takeaways and the KFCs and the whatnot, you know, all these, my kids, they all like those kind of things, but that is not good actually for the microbes. It's by really looking at fresh fruits, vegetables, and fermented foods actually, because fermented food also helps with your microbes. And then even potentially looking at probiotics. There's a link to say, you know, it's quite some evidence to say that in pregnancy, it's really beneficial for the mother to take some probiotics, extra probiotics every day, just to try to keep your bacteria, your microbes really healthy. Okay, because remember, you are the reservoir of these microbes that you're wanting to pass on to the baby. Okay, so keep these microbes good. Okay, then that's going to help. Then also important for your health and for baby's health is vitamin D. So get into the sun. Okay, we live in South Africa. Use the sun. Obviously not sunburn and so on, but get into the sun every day. It is it's really healthy to actually have enough of that. And then also exercise is really important. There's lots of research about that, and I'm not going to go into that because we all know exercise, pregnant, non-pregnant, for every person, it's really good. And then try for a natural birth. Try, you know, get your, you know, the talk with your doctor, with your care provider. And if you cannot have a natural birth, do the seeding possibly, you know, with the swap seeding, or by wearing the blankie and things like that. And then once baby's born, skin to skin, breastfeeding, and lots of breastfeeding, so that you basically helping these microbes to really become really strong and to take over and to help your baby to remain healthy. Okay, so I know that's a whole mouthful of things, but if I can urge you today, go and do your research on microbes, on the human microbes, on even what's it called, microbirth. If you Google these kind of things, you're going to get so much information. And the more information that you have, the better, because the better you can have good conversations with your caregiver about your pregnancy and about your health and about your baby's birth, and then also after birth, you know, breastfeeding and caring for your baby. So I hope that's actually, you know, helped you a little bit and that you got some information. Thank you. Are there any questions? And we can just look at some of the questions. You know, this topic is so important. It's not just for your own health, but if you think you are growing a little person currently and you want the best potential outcome to this person and the health of this baby, and a lot of the things that you're doing currently, what you're eating currently is affecting your microbes, which directly basically affects your baby's microbes after birth. So that is why it's really important to understand this. And really, that's why I said again, basically do your research, go and read up on this, and really have some talks with your care providers about the microbes, because it's becoming more and more of a thing, and it's more and more important to really understand that. Years ago, nobody knew about this. Nobody knew about the microbes and the importance of it. And nowadays, it's really starting to become clear that what we do now actually affects not just us, it affects our babies, and in actual fact, it might even affect future generations. So make your the correct kind of getting the correct kind of information, and then by making good choices for yourselves and for your babies.